Welcome everyone to the Winslow Health webinar in conjunction with the Barwon Health Foundation. My name is Francis Trainer. I'm the Philanthropy Manager with the Foundation. I'm delighted to be your host this afternoon. So let's start by acknowledging the traditional owners of the land. We, the Barwon Health Foundation, acknowledge the traditional owners of the land, the Wadawurrung people of the Kulin Nation. We pay our respects to the elders both past and present. We thank the traditional owners for the custodianship of the land and celebrate the continuing culture of the Wadawurrung people, acknowledging the memory of honourable ancestors. We also welcome all Aboriginal and Torres Strait Islander people joining us for this webinar this afternoon. And joining me today is Katie Every, clinical nurse specialist at Geelong's own Andrew Love Cancer Centre. Welcome along, Kate. Thanks for joining us.
Thanks for having me.
Good. And a special welcome to everyone from Winslow Constructors, both joining us live for this webinar and also to all of you who are watching the replay or listening to the replay at some point in the future. It's great to have you all on board. Now, Winslow have been a great supporter of Barwon Health Foundation and by extension Barwon Health, and their amazing support has gone a long way to ensuring the best care of patients at our health service. And just as we're so lucky to have University Hospital looking after the health of our community in the greater Geelong region, we're also extremely fortunate to have the support of companies like Winslow, so we thank you very much for that. I was impressed to see the vision and values of Winslow from their website, which included hard work, care, self-belief, innovation, discipline, safety, productivity and teamwork, which are just outstanding values to aspire to, but the proof in the pudding is their actions. And by generously supporting the local health service and having the care for their staff to be conducting these health webinars speaks volumes for the quality of the people and the people behind them. Speaks volumes for the quality of the company, I should say, and the people behind them. One of the big events that Winslow gets behind is the annual Run for Geelong, an amazing community fun run. I guess we call it a fun run, but can also be an event as much for the serious runners, for the enthusiastic amongst us, not me, and also for those who are happy to have a slower jog or even a walk through the various courses for the good of the community and good health. Winslow's involvement in Run for Geelong started in 2019, last year, and this year, under the restrictions of COVID-19, the event's being held as a virtual run, which will still be a lot of fun on Sunday, the 15th of November. And in coming weeks, we might even get our event organiser, Danny Flowers, to join us and talk about the plans for this year's virtual event. But in the meantime, you can go to runforgeelong.com.au, that's run numeral 4, geelong.com.au, and read all about the activities and register for the event. So thank you, Winslow Constructors, for your wonderful ongoing support. As I mentioned earlier, we're delighted to have Katie Every, clinical nurse specialist at Geelong's own Andrew Love Cancer Centre here at University Hospital Geelong. Now, cancer is a leading cause of death in Australia, resulting in almost 50,000 deaths last year. That's around 1 in 10 deaths. An estimated 150,000 new cases of cancer have been diagnosed in Australia this year, with 1 in 2 Australian men and women diagnosed with cancer by the age of 85. Just about every one of us is touched either directly or indirectly by cancer. The positive news is that in the 1980s, the cancer survival rate was less than 50%. Today, almost 7 in 10 Australians will survive for at least 5 years after a cancer diagnosis. And in some cancers, the survival rate is now as high as 90%, which is amazing. Geelong's very own Andrew Love Cancer Centre is a leading cancer service providing excellence in detection, care, treatment and research for the people of our region. So welcome again, Katie, and thanks for taking the time out of your busy schedule, which we were chatting about a little bit earlier, to join us today.
My pleasure, Francis.
Now, Kate, I understand you live in Ocean Grove with your husband and 3 boys.
I do. I'm very lucky living by the beach.
So apart from a very important role at the hospital, you must be a pretty busy mum.
I am. My 3 teenagers are all at secondary school, just at our local school in Drysdale, and I've been in Ocean Grove now 20 years. I've been at Andrew Love 15 years, which has been fantastic to be part of a really dedicated team. So my week is quite busy. At the start of the week, I work in Andrew Love as a clinical specialist in the oncology day unit. And then I'm also a secondary school nurse for the rest of the week. So yeah, time does go very quickly, Francis.
So, and you've chalked up 23 years with Barwon Health. So what did you do before this went to Andrew
Prior
Love?
to working at Andrew Love, I worked in the inpatient ward, which is now the equivalent of Baxter 6. So that's where you go if you are unable to have your chemotherapy as a day patient, then you have your chemotherapy as an inpatient. So prior to working at the Andrew Love Centre, I worked in the inpatient ward as well. So,
And then 16 years at Andrew Love. So tell us about what you've seen, and what it offers the community over that period.
Geelong community are so lucky to have the services of Andrew Love. I think in the time that I've been at Andrew Love, I've seen 3 renovations, which have all been well supported by the foundation. And in that time, I've seen the services just grow so broadly. We currently have 16 chairs in our day patient ward, but one of the big changes that I've seen in the last only 5 years, a cancer support centre or our wellness lounge has been built and attached as part of the services to Andrew Love, which has been an amazing addition to our service as a whole and what Andrew Love can offer our patients. In the wellness lounge, there's things such as yoga, massage, a wig library, computers that patients can use. So as far as what we offer our patients outside the medical pathway, so, we've got the team of oncologists, hematologists, each tumour stream now has a clinical coordinator, which has been a new initiative in the last 2 or 3 years. So we have a prostate coordinator, a breast care coordinator, a haematology coordinator, a brain and lung coordinator. So they've been a fantastic addition to the Andrew Love, and it just broadens the services of what we can offer our patients, and just the treatment advancements, just even in the radiotherapy department, has been amazing. So many changes as far as what we can offer our patients here in Geelong at the Andrew Love Centre.
And what's your current role? And sort of take us through, a day or a week.
Yep. So as a clinical nurse specialist, a big part of our role is education. So we educate patients on the side effects of chemotherapy and radiotherapy and how to manage those side effects. When a patient comes into the Andrew Love Centre, they see the doctor first, usually the day before they have their treatment. Then they have a blood test prior to arriving. So by the time they come to the day ward, that bit of background preparation has been done. They've seen the doctor, they've had their bloods done, so we know that they're good to go for chemo. So there's 3 types of ways you can have your chemo: through IV administration. So sometimes it involves putting a cannula in the patient, or they may have a central line device, which is a Hickman's line or a Portacath. So we need to access those. We give them what's called a pre-med. So before they start their chemotherapy, they have pre-meds to help reduce the side effects of the chemotherapy, which have come a long way, and they've really advanced in just the control of nausea and vomiting throughout the chemotherapy. So chemotherapy, people can come in for 10 minutes, they can come in for 15 minutes, or they can be there for 6 hours. So many different types of chemotherapy available to treat different tumour streams, which often determines how long of length that they're in for their treatment. So it's a really broad variety of different times that patients come in for their treatment. But yeah, education is a big part of our role, as well as the administration of the chemotherapy, and sometimes looking after the family as well as the patient. And we have to look at supportive care services as well. So we offer dietitian, psychologists, counselling, sort of goes beyond just their treatment on the day. And what they may need afterwards as well. We're very lucky we now have a pharmacy department within our Andrew Love Centre, which has been a new addition in the renovations last year, so patients can get all their discharge medications and everything that they need from our centre instead of going to the pharmacy within the hospital, which sometimes patients get a bit lost in that area. So it's nice to have everything at our fingertips.
So it's obviously a very challenging and stressful time for the patients, but I guess it gets very, very emotional and stressful for you and your colleagues. How do you handle that?
I think we're really lucky in Andrew Love. We have a very supportive team. I think we all work very well together, and I think in stressful situations we do turn to each other and draw a lot of strength from patients and what they go through. So we work really well together alongside the doctors as well. So we're very lucky our doctors are within Andrew Love Centre as well. So they're easy, accessible and good to consult with, and we work really well as a team. And it has been extra stressful, I suppose, during COVID for our oncology patients and for staff. With chemotherapy patients, they're immunosuppressed anyway, so they're very prone to infection. So at this point in time, even people that aren't prone to infection have been worried about COVID, but for our oncology patients, it's been extra stressful because they are immunosuppressed and they are vulnerable to any infection. So for them to be exposed to COVID would be just devastating. So it has been a stressful time for everyone. But
Yeah.
everyone's pulled together really well and has worked really well to work as a team to achieve positive outcomes even during this time.
And you mentioned before there are 16 chairs at
Yes.
Andrew Love, and I guess there's a rotation of patients using those chairs.
Yeah, we can average sometimes 50 patients a day, and just because they all vary from different treatment times. So some patients might come in for an injection for 15 minutes. Some people might come in for a blood transfusion or a platelet transfusion and might be there for a couple of hours. Or some patients may come in for some chemotherapy for breast cancer and maybe only in for an hour. So it does vary. And because of that varied timing, we can schedule many patients throughout those chairs. And as a nurse, there's about 6 of us on the floor. So we get allocated 3 or 4 chairs to work with, and we move through the patients throughout the day. And that's kind of how it works. Yeah.
And what would be the average duration that the patient would be coming in for that sort of treatment?
So chemotherapy is given in cycles, what we call cycles. So it might be, if you had breast cancer, you might come in for 6 cycles of chemotherapy, but those 6 cycles might go over a period of 6 months or 12 months, depending on your diagnosis, depending on where your cancer has spread, or where your primary is. So it does vary. Or it may be that you require, you've got a hematology cancer where it might require that you have maintenance chemotherapy, even when you're into remission. Sometimes you require maintenance chemotherapy for 2 years after diagnosis. So some patients we get to know really quite well. Some patients might come in every week for their chemotherapy. So that's a really positive aspect of my job, that you do get to know patients really well, and they do get to sort of become almost part of your lives, and you become part of them because you do see them quite frequently throughout the course of their treatment plan.
Yeah, and I guess
Radiotherapy is a bit different. With your course of radiotherapy, it might be that you're coming in every day, Monday to Friday, and your treatment course goes over a month. So it's a little bit different with the radiotherapy.
So can you just explain radiotherapy, exactly how that works?
Yep. So depending on where your disease is, or where your tumour is, and sometimes radiotherapy isn't an option. But how radiotherapy works, it's designed to kill or damage cells that grow rapidly. It's an X-ray beam. I'll try not to go into too much detail, but it forms as an electron from a radioactive source, and it generally just directly affects the area that you're being treated. With chemotherapy, you receive the chemotherapy IV, so it's a whole body treatment. With radiotherapy, if you had breast cancer, the electrobeam goes straight to where your tumour is, and it damages the cancer cells where the tumour is. So that's kind of how that works in a not very scientific explanation, Francis.
Can you explain some of the ways as an oncology nurse that you can support a cancer patient through that treatment?
Yes.
And the
Yep.
side effects that they're exposed to?
I think with our role, every time we see that patient, so if they come in for chemotherapy, we do an assessment on that patient and work out how they're travelling as far as their side effects. So chemotherapy affects everyone completely differently. So what I might experience as quite a cytotoxic side effect, you might not experience. So it's really important to clarify and grade where they're at with that treatment, because sometimes it might be that we are the first port of call where they discuss their side effects. And it's really important to stress from the patient from day one of their treatment to report any side effects they're experiencing, because sometimes what happens with the chemotherapy is that if they have, say, what's called peripheral neuropathy, where the chemotherapy damages the nerves in their fingers and toes, and that's a grade 2, they're rating it as about grade 2, so it's quite severe. We might then go and talk to the doctors and say, this patient's got peripheral neuropathy, we need to downgrade the chemotherapy. So they get their chemotherapy at 100%. But if they're experiencing any side effects, they might say, okay, well, we need to drop the chemo down to 95%, and that will in turn help with their side effects. So it's really about getting on top of all their side effects. So we look at all those aspects as a whole, how they're coping, do they need any more anti-nausea medications? So we look at just basically how they're travelling, and does there need to be any changes in their regime or their cycle of chemotherapy so that it's not so toxic, so that they can continue on with their treatment. So they might get it at a slightly lesser rate, but they can still continue on with their treatment.
Yeah. Katie, can you tell us how many different forms of cancer are there, roughly? And are there any that can't be treated, Andrew Love? Are there any that people still have to go up to?
There are sometimes, oh gosh, I couldn't even put a number to how many different types of cancers there are, because you have hematological cancers, which are any cancers that are affected in the bloodstream. So they're things like multiple myeloma, leukemia, chronic lymphoma. So you have that category of diseases which sometimes require high dose chemotherapy and then onto transplant. So sometimes they have to go to Melbourne to have their transplant. Mm-hmm. There's so many clinical trials popping up at the moment, and Andrew Love has a fantastic trials department, and we're really up there as far as what we can offer in the trials area. But sometimes it might warrant that they do have to go to Melbourne for something a trial that we don't have on offer at Andrew Love. But just in the time that I've been involved with Andrew Love, just the degree of what we can offer patients now that they don't have to travel. When I first started at Andrew Love, we had to bus patients down from Ballarat to get their radiotherapy. Ballarat didn't have a radiotherapy department. We're very lucky that as part of Andrew Love, we offer our rural patients accommodation. So we have units across the road from the hospital. So we service a lot of patients from the Western District, so they can have their radiotherapy and stay at the hospital accommodation, which I think is a fantastic service that we can offer patients, especially patients that are farmers or come from rural areas that don't know Geelong so well. So to be across the road from the hospital just takes away one less stress if they have no family in Geelong. So to be able to offer that service as well is fantastic. And it's a lot less stressful for patients, say from the Western District, to be able to come and have their radiotherapy and their chemotherapy in Geelong rather than have to go to Melbourne, which is what they used to have to do. So now Warrnambool has a radiotherapy department. I think that was in the last 3 or 4 years. So that's another fantastic service for that region as well. But yeah, our services do spread wide and far to different patients within the region.
Yeah, you mentioned the clinical trials, and it was a fantastic announcement not so long ago. The wonderful Costa family have invested in the Adrian Costa Clinical Trials Centre, which is going to bring all the research clinical trials under one roof. So we really look forward to that. Katie, so during COVID, anecdotally, we heard a lot of patients with different ailments, cardio problems, weren't presenting at the hospital and weren't going to doctors for fear of leaving home and potentially exposing themselves to the virus. Has that, you've seen that in cancer as well, or?
Oh, definitely. There's if we looked at the amount of new cases being diagnosed or new cases that present to us, I think that would be far less than normal. And I think that's definitely a COVID complication, I guess, because people haven't been able to access services as more readily as what they normally would. I think COVID as a whole has really impacted on cancer patients. Just from what I've seen, people's, like what I mentioned before, their heightened anxiety about infection, even caregivers not being allowed to attend appointments. So for some patients, it's difficult to describe their side effects, whereas sometimes the caregiver speaks for them. So to not have their visitors and caregivers with them is a little bit tricky as well. Telehealth has been amazing this last 6 months, and I think that's a positive out of COVID that we will take forward, that some patients we can do telehealth with. We can educate patients via telehealth. Sometimes it can be a negative if the struggles with technology and older patients, but generally speaking, telehealth has been a fantastic asset to us. And I think just less people getting screened has an impact. So I think, yeah, that certainly has had an impact on cancer patients within our region.
And in telehealth, in terms of cancer, can they be actually treated at home as well?
We are so lucky. We have a hospital in the home program that was existing pre-COVID. So a lot of our patients access that service. Unfortunately, they can't receive their treatment if they haven't already. There's only a limited amount of treatments that can be accessed through hospital in the home, but we're so lucky and so fortunate to have an oncology hospital in the home program, because patients can get connected with a little chemotherapy bottle and they can go home for 3 days. So that was something that I've never seen before when I first started oncology, just a little while ago, Francis, not too many years ago. Patients would have to stay in for 5 days and be an inpatient and have their treatment. Now they can come to us, we can start them off, we can hook them up with a little bottle to go home, and they can have their chemo at home for 3 days. So that in itself, to be able to do that at home is fantastic.
Yeah. Now, the foundation and the Andrew Love Cancer Centre have a really strong relationship, have for many years. And I think some people might be interested, what the foundation have been doing with for staff during COVID.
The foundation has been amazing. Just the way that the foundation have brought the community together, I think, to support Geelong Hospital as a whole. I was talking to a lady up the street in Ocean Grove, and she said, I was so excited to see my name pop up. I paid for all the coffees on a certain day. So to bring the community together to thank frontliners, healthcare workers, I think is amazing. I think the foundation have worked really hard to have a community connection with the hospital, but not only the foundation have supported many programs in the Andrew Love and assisted with Dry July and fundraising throughout our last renovation, which has only happened in the last 2 years. So the last renovation has been amazing. Just the modern, up-to-date patient comfort is just, yeah, it's beautiful. We're very, very fortunate and blessed to have the space that we can work from and provide for our patients.
Yeah, it's great. The statistic I mentioned earlier about cancer survival rates is quite gobsmacking in terms of how successful treatment and our awareness for avoiding cancer has changed. And I'll just repeat it. So in 1980, the cancer survival rate was less than 50%. And today, almost 7 in 10 will survive at least 5 years, and after diagnosis. And in some cancers, the survival rate is as high as 90%, which is really extraordinary. Cancer doesn't discriminate, but Katie, there are some things we can do.
Francis, there's lots of things we can do. And I think those survival rates have definitely been a reflection on just introductions of new therapies such as immunotherapies, but also from the education that people have had from screening. I think if you can take away one thing from today is to ensure that you do the appropriate screening for cancer that you can do, because it makes an amazing difference. Early detection is a big reason for these increase in survival rates. So things like doing your bowel kit. No one wants to do it, but really essential to do your bowel kit. Breast screening, just a must. Simple things like going to have your skin checked, doing your pap smear when you need to. And things like if you are getting a prostate check, if you feel that you have a lump somewhere or something doesn't feel right, years ago we might have put it off and said, oh, look, you know, it's just, it might be my glands or something like that. Don't ignore it. Just go and get it checked straight away, whether it be a little lump in your neck, whether it be your testes don't feel right, or you've got some blood in your urine or blood in your stools. Just basically don't ignore these symptoms, because sometimes it can be life-changing, that it's an early detection, that, and even going beyond that and thinking into our daily routine, things that make a big difference are the amount of alcohol we consume, moderation, exercise, sunscreen, slip, slop, slap. All those things can make a huge difference. Yeah.
Well, that's great advice. And just look, as we know, just about everyone that was touched either directly or indirectly by cancer. But it's the extraordinary doctors and the amazing healthcare heroes like you, Katie, who make that daunting journey through cancer just that little bit easier. So we really thank you on behalf of the whole community, not just the foundation, the whole community. Thanks so much for everything.
Francis, I feel privileged to be able to help people in a really stressful journey. So I think, I do feel really lucky, and it's a great place to work, Andrew Love. So, I don't take it for granted, and I am very lucky. And also thank you for the support for Run Geelong. I've actually signed up, Francis.
Good work.
I've started my campaign.
How far are you going?
I'm going to do the 12.
Good girl.
Yes, I've done it a few times now. So I feel like if I don't do the 12, it's an injustice now. So it's a good motivation.
And you can nominate which area of the health service you want to support. So I'm assuming yours will be the Andrew Love Cancer Centre.
Of course, absolutely.
Yeah. Well, Kate, look, that 30 minutes went pretty quickly, and I want to thank you so much again for all you do, but particularly for being here today. Thanks also to Winslow, and thanks to everyone for tuning in. We've got a few more upcoming webinars, one on mental health, one on heart health, and then we've got general health in our last week. So we hope to see you joining us for that. Thanks again, Kate, and thanks everyone for joining in.
Thank you, everyone.